Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty member appointment at Ross University School of Medicine. And this is a very serious topic, and it's a topic that is very difficult to even talk about because it's tragic and it's something that not only devastates the person that experiences it, but also has long-term consequences within the family. And so for Suicide Awareness Week, I wanted to try to provide some context and insight as to how some of the measures work and how to understand suicide better. Now, this is such a broad topic. I'm gonna start off by saying this. This is such a broad topic that there's a whole field known as suicidology, and there's an association even that is pertaining to this. So if you're specifically interested in the mental health aspect and more importantly interested in suicide, then you can go to this website. I've actually had students that have developed dissertations, and this is about 150 to 200 pages, utilizing some nationally representative data sets to understand the effects of suicide and in the context of different populations. So I'm going to share with you some of the research, some of the primary research that I have done as well in this area. But let's get started before I bore you with this first slide. Now, what's the theme this year? Well, suicide prevention begins with all of us. And what does that mean? Suicide, or even the idea of suicide, is in many ways religiously frowned upon. In some beliefs, it is thought that if you do and end up committing suicide, then your soul would suffer. And maybe that was put in place in a protective manner, but all of us have to be on board. Advocacy is important, and so that is the theme this year. September 4th through 10th. So suicide is the 12th leading cause of death in the United States. Now, I will say this, that it was actually a number of years ago within the top 10, but it's still a considerable problem. And I'll also say this, that in specific subpopulations, it's actually higher. In 2020, 979, about 46,000 individuals died by suicide. So now looking at National Suicide Prevention Week and some statistics that kind of bring home what is known. So the age-adjusted suicide rate in 2020 was 13.48 per 100,000 individuals. The rate of suicide is highest in middle-aged white men. In 2020, men died by suicide 3.88 times more than women. And that's quite a significant disparity. On average, there are 130 suicides per day. What's more is that white males accounted for nearly 70% of suicide deaths in 2020. In 2020, firearms accounted for 53% of all suicide deaths. And I've done a lot of firearm research. I've, in fact, conducted a 20-year analysis of descriptions of mass shootings and how firearms and firearm sales contribute to that. And I think a similar pattern would emerge if we were to look at firearm-related deaths and suicide rates across the country, and I would suspect that that would correlate. So that's another research topic to be thinking about when you're thinking about suicide. 93% of adults surveyed in the US think suicide can be prevented. And that's good news, because then we know that people know that there's ways that you can prevent this before it becomes acute. So 1897, schizophrenia history was explored using social environment of suicide. Similar to other studies in mental health, usually, what I was trying to say is that through the historical context of suicide from 1897, schizophrenia history was explored. So understanding that social environment of suicide was related to schizophrenia. This was the first time that psychology and all of these mental health fields was experiencing kind of a flourishment from this original research in suicide. So this stemmed research in psychology. Now, I wanted to take a little bit of a moment to understand. I went over some statistics. Now, those of you that are diehard researchers, you might be wondering, so how do I even screen for suicide? Or those of you that actually encounter patients within the clinic, you might be thinking, if I have a suicide screener or more of a detailed suicide screener, is that even effective? Because most people are saying no. And there was this interesting case study with avatars and interactive components where an individual was asking specific questions to the receptionist and also the nurse practitioners and different places as to the necessity. And this individual was Nathan, and he was asking each of these individuals, nurse practitioner, the receptionist, and other individuals, why it is important, and do they feel it is important to ask a more detailed screening question for suicide. As of now, in the PHQ-9, Patient Health Questionnaire-9, which, by the way, I have used for my research, the question is, over the past 2 weeks, have you been bothered by thoughts that you would be better off dead or of hurting yourself in some way? Think about that question for a second. When you're looking at that question, do you find it direct or confusing? And if you answer it, it's a bit confusing and indirect, you answer correct, and you probably, if you looked at the gray portion, you probably would have known the answer. But I think even if you evaluated it on your own, you would probably come to the same conclusion. Now, there has been a suggestion to enhance item number 9 so that there is an additional direct suicide question, which gets at the center of what is being asked. And so over the past 2 weeks, have you been bothered by little interest or pleasure in doing things, feeling down, depressed, or hopeless, thoughts that you want to kill yourself, or have you attempted. So this is more direct, and of course the provision of resources are especially important. And there's several hotlines through SAMHSA and even crisis text line 741 that allows for you to reach out to individuals when you're going through crisis. But some of the other screeners include safety, which assesses for ideation, planned behavior, and intent. Columbia Suicide Severity Rating Scale, Ask Suicide Screening Questions, and Patient Safety Screener. Finally, I wanted to leave you with some references for some of the original articles that I've written and collaborated with others to provide more of an overview and understanding of suicidal ideation. In this paper in 2021, where I collaborated with Dr. Richardson, we actually found that as far as diabetes affecting overall mortality, of course, increased diabetes was associated with increased overall mortality as we expected. But we wanted to see how other comorbidities such as heart failure modifies an effect such as that. And of course, what we were more looking at, instead of looking at the whole population, what we wanted to look at is in individuals that had experienced suicidal ideation. And so when we looked in this particular subpopulation, this was something that was shown as significant. Now, having said that, this is something that is connecting not only mental health, but also connecting with many of these chronic diseases, a constellation of chronic diseases, and overall mortality. So there's several concepts that are connected in this first research idea. A theory is that suicidal ideation leads to increased allosteric load, which in turn may lead to some of these diseases. In addition, you got to think of the fact that there may be lower medication adherence for individuals. The next one was looking at suicidal ideation and cardiovascular mortality in postmenopausal women. And so, of course, without the protective effect of estrogen, cardiovascular diseases and mortality is more common, but what was not expected is that how suicidal ideation would be connected with that. But again, increase in allosteric load, increase in neuroendocrine markers and neuroendocrine inflammatory markers can connect this, and this was published in the journal Maturitas, which is actually a very high impact factor, I believe, at the level of 10. And this was a collaboration with Ms. Campbell, who is a current student at Walden University. And then the next one was a collaboration with one of my former graduates from Walden University, from my doctoral graduates, and we looked at, within this paper, within the Annals of Epidemiology, this was published, marijuana use versus suicidal ideation in the context of broadening legalization. And this was an interesting study that was conducted, again, in a nationally representative data set, but on National Survey on Drug Use and Health. And we had some unexpected twists within that dissertation journey, where some of the data set had disappeared without notice, without without too much notice, and so we had to scramble to redo the plan proposal and see where we could then effectively go through the challenges. So then that ended in a publication and even a podcast series. This is, of course, a very serious topic. It's a topic that is somber, and it requires more understanding and more screening within the general population. And I hope this has provided enough guidance and insight, not only for those of you that may have experienced this, but also for individuals that are looking to further research and perhaps pursue suicidology as a specialty. Thank you for listening.